Hi, I'm Dr. Nilam Khurana, and I am going to talk to you about feeding today. So, starting solids is a very complicated thing, and a lot of times what happens is we give you loads of information at your 4-month well visit and to prepare you for the 6-month. And I've been finding that with everything, COVID has been a little bit more difficult because there's only one parent there, and then there's so many additional questions that we don't necessarily hit all the big topics or convey all the information we want to for learning to eat solids. So this is just a little bit of information on how to eat solids. So basically for babies when they're 6 months developmental, so they're sitting well without support, there's no weeble wobble of the head, they're really solid and strong, and they're diving down for your spoon. Like literally they'll just stare at you while you're eating and go, and then they'll watch you and they'll watch the food go into your mouth. So it's clear, the signs are obviously there. And as long as they're good with their support and they can sit well with very little support or no support at all without like tipping over and falling, they're good to start with solids, obviously in a high chair or a chair that's going to give them good support for their back. And so a couple of things about solids. One is learning to eat is learning textures. So you build up as you go. And then the other area is the food allergies and how things have been changing a lot lately. So regarding learning textures, I usually say to start with a little bit of the baby cereal that you get in the store. It's the powder, and you mix it with either the breast milk or the formula and feed it to them with a spoon. If they thrust their tongue out, they're just not developmentally ready yet. So they will clearly let you know. Again, if they do that, then just wait a couple of weeks and then you can try and feed them. Initially, you're going to go liquidy, and then you're going to go up as fast as they tolerate it. So at 6 months, they're eating sometimes a little bit liquidy. Sometimes they go straight to like an oatmeal-y texture. And then by 9 months, they can be eating finger foods like fruit puffs. So it really progresses fast. So you want to get to where they're comfortable as far as texture, and then just keep pushing a little bit more change in texture as they go, obviously not providing choking hazards or anything like that. But if they are good with like an oatmeal texture, or when they are, then you can do things like mashed banana, mashed avocado. I usually like to do as much home food as possible. At least that's what I did for my girls, because for one thing, the baby food in the store is disgusting. But also I think that it really helps them learn the flavor of food, because I feel like when they're eating the stuff that doesn't have any flavor, they really are overwhelmed when they actually get to real food, and it makes it harder for them to transition to real food as toddlers. So for those of you who can make it at home, I know it's a time constraint. What I say is to do more liquidy stuff initially. So squashes, like yellow squash, I use as a water base. So cut it up, steam it, puree it, and then you can put it in the ice cube trays, stick it in the freezer, and then you can take it in a Ziploc bag and store it, and then you can always just defrost it a little bit to mix in with anything. So you can even use yellow squash puree as a total liquid, like water base. Zucchini is a good first food liquidy texture, and then you can bump up to things like potatoes and butternut squash and sweet potato as far as the veggies go. And they always say do veggies first because you don't want them to get used to the fruits. But really just figuring out what it is in the food that you can do that you have at home so that you can get them the variety of fruits, veggies, and grains, and then working up on the texture. So that's generally about textures and working up on it. As far as food allergies and proteins, so we used to say no peanut till God knows when, and then no eggs and shellfish and all these other things. So things are changing a little bit now. So if you're low risk, you don't have any peanut or egg allergy in the family, the child doesn't have any severe eczema requiring any use of steroid creams, and the child is done fine with breast milk where mom didn't have to reduce anything or restrict anything in her diet, or formula, just regular formula, you didn't have to change to broken down formulas or anything like that, then you're considered low risk. So low risk kids can start with smooth, watered down peanut butter mixed with the cereal. So you really want to get at that liquidy texture, smooth, because you can't, again, they're not going to be able to tolerate chunky. And it's a choking hazard if it's really not watered down enough. So, and that starts at 6 months, at 4 months if they're eating, depending on, again, when they're 6 months developmental is when they start with their food. So some kids are there before 6 months. So it's just one of the starter foods and you continue to introduce it. And the idea is if we don't introduce it until later, then kids will end up developing an allergy because they'll think of it as something as foreign, like a virus or something like that, and build an immune response and then attack it. So earlier introduction is better. And they've done studies on this to verify that it was okay, but for who knows how long they've been doing peanut puffs in Israel and introducing these proteins early on in life. And so the higher allergen proteins are the dairy, eggs, nuts, shellfish, and there's no guidelines for anything else, but the guidelines for peanut are there. So you can start with those. And then if they are low risk allergies, some people have been doing early, like scrambled eggs or baked eggs. Again, those are the higher risk for allergies. Dairy is fine, like in yogurt form, or as they get a little bit bigger and able to do things that have cheese melted in stuff like mashed potatoes with cream, things like that. So that's the main part about solids and allergies. And then you'll see as they go, they'll just develop that desire to eat more of the thicker textures and mixed textures and finger foods. I usually say to start with a piece of banana or avocado or something that's mushable in their finger. And when they're ready to pick up things with their 2 fingers is when they can start with the finger foods. And you have to make sure that they put it in their mouth and they gum it a little bit in the front and then they swallow it. So if they can gum it a little bit, then any of the things like the fruit puffs or things that are really going to melt or mush before they get back to the throat are good. Cheerios, I want to make sure that they're actually good with it before they do. Although on the developmental questions, we ask you about Cheerios in a bottle and things like that. So you can give it to them and take it away. But after that, it becomes pretty straightforward. Obviously, you're avoiding the choking hazards and working up on texture and variety and things like that. But that first time is really important. The other thing that parents will ask often is, how much should I feed them? Well, with solids, they can eat as much as they want to. They clearly know. They will eat, and then one bite and they're done. And they will like turn away or they'll make a face at you. So it's not really like the bottle where you can overeat with the bottle. It is really extremely rare that kids overeat with solids. And then they get to a certain point where they're eating ginormous volumes, like as much as you could eat. And that's because their brains are developing. They need a lot of nutrition for their brain development. 90% of your brain development is in the first 5 years of life. So especially in the first 2 to 3 years. So they'll eat a lot. And then all of a sudden they'll get to like toddler age and you'd be like, why are they not eating anymore? Because they're eating for their size now, not for their brain. So that's a little bit about feeding. I hope that helps. And I look forward to talking to you guys soon about other topics and seeing you guys soon in the office. Thanks for listening.